So today let us discuss why should we denervate our muscle flaps. For example, if we are harvesting a gastroc muscle flap or a pect major muscle flap, we should always transect our motor nerve. Let us see why. First of all, when we transect our motor nerve, there are less chances of muscle spasms. Less chances of muscle spasms means less contraction pain to the patient. Less chances of muscle spasms means less chances of suture line breakdown. Also, when we transect the motor nerve, the muscle tends to atrophy in due course of time. Atrophy means better aesthetic results. When we transect our motor nerve, that reduces the energy requirement of that particular muscle. So the blood supply remains the same and the energy requirement goes down. So I think we could possibly call it some sort of vascular augmentation. Also, it has been shown biochemically that there is increase in density of capillary network around each muscle fiber when the muscle flap is denervated. So if you are not denervating your muscle flaps, please do consider denervating your muscle flaps.